you know someone who's having a mental health crisis? Are you worried that they might even be at risk for suicide? And you're wondering how to help? Well, there are very specific things that you can do to help keep that person safe. Hi, I'm Dr. Lori Barker, and I'm a licensed clinical psychologist as well as an educator and consultant. And in this video, I'm going to walk you through the process of how you can help someone who's having a mental health crisis. So let's get started. Number one, know the warning signs and the risk factors for suicide. If you're wondering what those are, check out this video where I outline all of those. So it's a way for you to assess, the risk level for this person, to know the questions to ask or the things to look for to decide if they really are at serious risk for suicide. So that's step number one in helping them, is knowing the warning signs and the risk factors. Number two, ask direct questions. Don't be afraid to use the word suicide and to talk directly. So you can ask things like, are you thinking about attempting suicide? Are you thinking about killing yourself, about harming yourself? It is a myth that if you talk about suicide, that you're actually increasing the person's risk. In fact, the opposite is true. If you have them talking, that helps relieve some of their stress. And if they're still sitting there talking to you about it, then they're not out actually attempting. So be courageous. Don't be afraid to use the words, to ask those direct questions to get the information. Another direct question you can ask is, do you have a plan? Because that's also part of assessing risk and knowing how much danger they might be in. So if they have a very specific plan, they go up on that risk meter. So that's part of asking direct questions, getting that information that you need so you can provide the best help possible for that person. And when you're talking to that person, be sure to listen without judgment. You may have some specific feelings or ideas or opinions about what they're going through or what they should do or shouldn't do, but try to keep those to yourself and just listen actively and show the care and concern, empathy, and compassion that you have for that person and that they need so much in that moment. Another important step that you can take is limiting the person's access to the means. This is why that question about if they have a plan is so important, because taking away access means limiting their ability to get a hold of that, whatever method they're going to use to try to attempt suicide, and taking away their ability to do that. So for example, if it's someone who is thinking about overdosing on pills, maybe you go and you empty out their medicine cabinet and you keep those medications in a safe place. Or if it's someone who plans to use a firearm or a gun. In fact, most people who complete suicide do so using a firearm. So if you can limit their access to that firearm, chances are you can prevent a suicide. Another prevention step that you can take is strengthening the barriers to suicide. In other words, what has prevented that person from doing it so far? Again, you want to ask the questions. Well, you're still here. Why haven't you done it yet? What has stopped you? And people might list many different things. So for example, they might say, I really don't want to do that to my family. Or, because of my religion, I don't know what will happen to me if I do this. Well, then you want to lean into those things. So if the person is saying, I don't want to do that to my family, get them to talk about their family. Get them to talk about what impact they think that might have on their family. Or if they're talking about, it's my religious beliefs, get them to talk about those beliefs. How much, how strong are those beliefs? Do they really buy into it? Or are there any things in their belief system and their religion that are more comforting for them? Again, lean into it and get them to talk about those things. Another prevention strategy is to mobilize social supports. Many times when people are in mental health crisis or they get to that point where they're thinking about suicide, they are alone, whether they've isolated by choice or it's by circumstance. So one of the things that you can do is strengthen their social support system. Get them connected to other people. You can ask those questions. Is there anybody else who knows that you've been thinking about suicide? Do you trust those people? Or who are the people that you trust that you can talk to about this? If you start feeling that urge and that urge to want to attempt suicide gets really strong, who can you call? And get them to socialize more. So even if they're not willing to talk to people about it, encourage them to get out and do things with other people. Mobilizing those social supports can help keep that person safe. And you don't have to handle this alone. You can also recruit others. If that person who's at risk is not willing to talk to people, you can recruit other people to help you, other people in the friend group, other people in the family. You can let them know. Now, the person who's at risk might be a little upset with you for doing this, but again, if the goal is to keep them alive, that's okay, right? So you can tell other people and say, hey, we all need to join together and provide support, keep some eyes on this person, and help keep them safe. Now, another form of support that you can reach out to is a crisis hotline. So you could give that person the crisis hotline number. There are lots of them. I've put some of them down in the description below. And there are people, trained people on the other end of those hotlines that you can talk to 24/7. And if it's not a phone call, many of these resources also will do text or they'll do video chat. So lots of options. Again, check those resources down in the description. Another helpful thing you can do is help that person increase structure in their schedule. Again, if they're in crisis, they may be isolating themselves. They may have stopped doing things that they used to do that they really enjoyed. So getting some structure into their schedule can help. If the person is in school, encourage them to keep going to class, encourage them to keep doing their homework. If they have a job, encourage them to keep going to work. If they have social activities, like if they like sports or play on a sports team, they used to get together and play basketball with people, encourage them to keep doing those things so they have something to get up and do every day. And even again, if the person doesn't feel like it or protests it, encourage them to do that, and maybe you even go and do those things with them. Now, another thing that you can do is put together a safety plan for the person, and it can include many of the things that we just talked about. So what you can ask them is say, okay, what will you do if this urge to want to attempt suicide gets stronger? What are the specific steps and things that you can do? Let's write down, who are you going to call? Here's the crisis hotline number. When are you going to be going to the gym? When is your next class? So getting them up and moving and out and doing things is an effective way to keep them safe. Now, if you think that person is in immediate danger, meaning you're not sure whether, right now or today they may go out and attempt suicide, there are some, sort of more immediate things that you can do. One is, if you're with the person, to stay with the person and call for help and stay with them until that help comes. Now, if you're not with the person, one of the things that you can do is request a wellness check. So you can call the police, you can call 911, and you can say, hey, I'm afraid that my friend, my family member is about to attempt suicide. Can you please go and do a wellness check? And law enforcement officers will do that. Now, in some cities, some counties, they have a mobile crisis team where it's mental health professionals who will go out and do that. And you can Google within your county and ask if there's a mobile crisis team or a mental health crisis team. You can call that number. You can let them know the situation. And again, people on that team hopefully will go out and do a wellness check on that person. Again, the crisis hotline is another resource in this instance where you can, if you're not with the person, you can encourage them, give them the number, give them the website that they can call that crisis hotline. Now, by far, the most important thing that you can do to help keep someone safe is to encourage them to get professional help. That means helping them to connect with a professional therapist, a professional counselor. Because if they've got to that point, if they're in such a crisis that they are contemplating suicide, they need professional help. So there are lots of resources that you can turn to. I've put some of them down in the description for this video, but I also have another video. You can follow this link right here to figure out how to find a therapist. And I have another video about questions that you can ask to be able to match with the right therapist. So please follow those links, get that information so that you can pass it on to the person that you're trying to help. So remember, getting professional help is key. That's probably one of the most important things that you can do to help prevent a suicide. So thank you very much for watching. I hope that these steps were helpful because, again, we are in the midst of a mental health crisis, and there are concrete things that we can do to help ourselves and to help our loved ones, those around us, to improve their mental health and start living their best lives. Thanks so much for watching, and I look forward to seeing you in the next video.